session. So we are going to...
Everyone, we're beginning the next session. The next session's beginning now. Managing.
So we are going to the next section with how can I manage systemic sclerosis myself. And I'm very glad to be here. My name is Maria João. I work here in Portugal, in Coimbra. I'm a rheumatologist. And I'm very glad to make participation in your patient program in this challenging disease, not only for you as a patient, but also for us as doctors, because we want to have something to offer you, and we are not happy when that doesn't happen. But things are changing, are improving, and I think in the future many different and novel things will happen in systemic sclerosis. I have here Nina Patriotic, who is a patient in Switzerland. She lives in Switzerland. And we are going to introduce the first speaker, who is Professor Kwakkenbos, who works in the Radboud University in Netherlands, and also at the McGill University in Montreal, Canada, who she co-directs the Scleroderma Patient Center Intervention Network, SPIN. She has a PhD project focusing in issues related to quality of life in scleroderma. So, Professor, she will speak about coping with the everyday challenge in scleroderma.
There we go. Thank you for the very nice introductions. So my name is Linda Kwakkenbos, and I'm originally from the Netherlands, but I've lived in Canada and Montreal for a couple of years, where I work with Dr. Breathlessness on the Scleroderma Patient-Centered Intervention Network. And I'm going to speak a little bit about that, but also about the things that we're doing that will help you, may help you cope with the symptoms of scleroderma in your daily life. So I put a slide up here that says challenges of living with a rare disease, and rather than telling you what the challenges are, I know for a fact that you know better than I do. I just put a couple up here, and this is not an exhaustive list. Pain, fatigue, other disease symptoms, GI problems, but also sadness and maybe depression that you may experience. Changes in your appearance, so you may not want to go out as much as you're used to. Just heard about that in the last session, etc., etc. It may be difficult to cope with these challenges in your everyday life. And there's, in chronic diseases more generally, there's patient-centered care that focuses both on the medication.
Kwakkenbos, please, sorry to interrupt. Can you speak a little more slowly so they can translate to the other language, please? Okay?
Certainly.
Okay?
Yeah,
Thank you so much.
Thank you. So in chronic diseases, there's both medications that may help you ease your disease symptoms, such as painkillers or other medications that help with your GI problems, for instance. But there's also what we call non-pharmacological care, non-pharmacological interventions. And these are interventions provided by physical therapists, psychologists, occupational therapists, etc., that can help you cope with these challenges that you have in your everyday life. But if you look at the EULAR guidelines, European League Against Rheumatism, the most recent guidelines for the treatment or the management of scleroderma, we see that the experts cannot really make any recommendations for or against these interventions or these non-pharmacological treatments. And this is because there isn't a lot of research done in this area. If we're doing research, it's really hard to get enough people involved to really make any recommendations about the effectiveness of these interventions. So this is an important care gap that the Scleroderma Patient-Centered Intervention Network is trying to address. So what is SPIN? We're an organization of over 60 people with scleroderma, patient organizations listed here, clinicians and researchers from 8 countries. And we're working really hard to address this care gap, so the non-pharmacological interventions, the supportive programs that can help you cope with the everyday challenges of scleroderma in your daily life. And I've put the website up here. For now, it's only in English, but we're working on translating that in other languages as well to get some more information. So what exactly is it that we're trying to do? We're trying to build online, we call them toolkits or online programs, where you can log in and get information about your scleroderma, the different challenges that you may face in your daily life, and actually work through some techniques that may help you cope with this in your everyday life. Toolkits, so there's a lot of different information, and you'll be able to find information that is most suitable for the problems that you are experiencing in your daily life. We're doing this online, and that's for a reason. If we would develop this and only implement it in one center in the world, there's a lot of other patients with scleroderma who wouldn't have access to it. Whereas if we're putting it online, we're capturing a lot of people who have access to these interventions through the patient organizations that I just showed on the previous slides. So what kind of things go in these toolkits? It's relaxation. You can see it up here, for instance. Relaxation exercises may help with coping with pain, may cope with emotions and stress. And there's a lot of things that you can find about relaxation, actually easing some of the muscle tension, for instance, that may improve your pain. There's also some other things. We're focusing, for instance, on thoughts. Thoughts are very powerful in influencing how you feel, but also in how you react to a certain situation, such as you're having difficulty going to your work every day. Maybe you have to think about going on disability leave, and you think, I can't even support my family, I'm worthless. These thoughts are very powerful, and they're often not so subtle, right? If we really think about them, the thoughts that we have about a certain situation. And the things that you may want to ask yourself, a couple of questions to challenge these thoughts. For instance, if my best friend would think this, what would I say? And if my best friend knew that I have this thought, what would he or she say to me? And what evidence would he or she come up with to convince me that this thought is not completely true? Are there any elements in the situation that I'm missing? Or maybe I'm jumping to conclusions way too quickly. I think, for example, if you think about this thought, I can't even support my family, I'm worthless, a friend may say, like, you're still doing a lot. You're going out with your kids, you're going to their soccer games, etc., etc. There's a lot of things that you do for your family, and you're not worthless at all. And if you can challenge these thoughts and think about them a little bit differently, you will feel and react different to this certain situation. And 10 minutes is really too short to go into this in a lot of detail, but I do have some resources later on where you can find more information on this. Other thing that the SPIN programs or the toolkits are focusing on is behavior, things that you can do in your everyday life to cope with the symptoms a little bit better. And I just took another example where we're looking at coping with pain and fatigue. And this is what we call the boom and bust cycle, and it may look familiar to you. You're having fatigue or you're experiencing a lot of pain. You rest. You'll be frustrated probably because you can't go out or do the things that you wanted to do. But your symptoms will ease. Your pain or your fatigue will reduce a little bit. Then when you're feeling all re-energized, your pain has reduced a little bit, you feel like you can conquer the world, and you have to make up for this time that you lost while you were resting. That may be a thought or a feeling that you have, and you become overly active. And then as the next step, you'll have more pain and more fatigue as a consequence of overactivity. So one of the techniques that you may learn from a SPIN toolkit is what we call activity pacing. And activity pacing is basically summarized as consciously balancing your activity and rest. And I put this battery picture up here because pacing is basically not draining your battery completely, but rather than draining it completely, charging it a little bit every time you do something. So you do something, use a little bit of your energy, then you re-energize, you charge yourself by pacing yourself and not going into this cycle of the boom and bust. So just some basics, and again, I have more resources for you to look at afterwards. Pacing works in a certain way where first you need to know the amount of activity that you can do before your pain or fatigue would increase to a level where you're you cannot do your daily activities anymore. And then the second step is put that information, you plan your schedule, and you balance rest and relaxation with activities that you're doing. So think about this as the battery that I used before. So you're using a little bit of your energy, you're re-energizing, and then you can go on with the next task. And it's very important that you stick to your plan that you're making based on this. So you know that you can do vacuuming for 15 minutes, and even though you're not finished this one room or this one floor in your house, if you know that you can do it for 15 minutes, you stop after 15 minutes to take a rest as you have planned in your schedule, rather than trying to finish it until you're overly fatigued or in a lot of pain. So these are just the kind of things that would go in the spin toolkits. And I summarize it here, like even if you cannot control your scleroderma, you can to some degree control how you think and how you react to it. There's a couple of resources, I already said it, and one of the very important ones is getting support. And you're all here, and I hope you get a lot of support from each other. So you may get it from other people with scleroderma, but also from your friends, from your family. And remember that they can help you go through, help you with the everyday challenges of your life. And I know that Vanessa is going to speak a little bit more about support groups and how they can help. And then there's a couple of online resources that you can access, and these are not developed specifically for scleroderma, but for chronic diseases more broadly. And one of the resources is the Positive Coping with Health Conditions workbook that was developed by Dr. Dan Bilsker from Vancouver. And he gives a lot of techniques that you can implement in your daily life to cope with the emotional challenges, but also with the symptoms of your disease. Then the Johns Hopkins Scleroderma Center has a lot of resources online that you can read about. There's some information on pacing and instructions on how to make your schedule and how to stick to it. And if you want more information on coping with appearance changes, there's a website by patient organization Changing Faces, and they have a lot of good material as well that you can read upon. So for now, the spin toolkits are work in progress, and we're working really hard to get them up and running in the next couple of years. If you have any questions about this, please don't hesitate to send an email to SPIN. We'll get back to you and try and answer your questions. There's also the SPIN website, spinsclero.com, or you can come after this session and can see me or one of the other SPIN representatives, including my colleague Marie-Ève Carrier. We'll be around, and we'll also be at posters 195 and 165 at this conference. So thank you very much for your attention, and please ask any questions that may come up.
Thank you, Professor Kwakkenbos. I think we make the questions in the hand if it's okay with you. Yeah, okay, thank you. Excellent lecture and good advice for all of us, also the doctors. So the next speaker, we welcome Vanessa Delisle, who is a doctoral student in psychology in Canada, Montreal. And she will speak about do support groups help?
I think I am there. Yeah. Do I just use the arrow? Okay. All right, well, thank you for that introduction. So for many people living with scleroderma, coping with the disease can be really tough. Given this, many patients join support groups to help them cope with the emotional and physical challenges of the disease. So what's a support group? The way that we've kind of defined it through the literature is that a support group is a gathering of people who share common experiences. Activities of support groups typically involve an educational component, as well as the giving and receiving of emotional and practical support. Support groups can be formatted many different ways. So they may be held in person, they may be held online, or they may be led by patients or professionals. And when I say professionals, I mean maybe psychologists, doctors, social workers. And they may be structured with an agenda and predetermined discussion topics, or unstructured. Scleroderma support groups are available throughout North America and Europe, and the majority of these, so I've learned, are held in person and are led by patients. So recently our team was approached by the Scleroderma Society of Canada and the Scleroderma Foundation in the United States, and we were asked to help them develop an infrastructure, including a training and support program for peer leaders of these groups that would help increase the accessibility and the effectiveness of current support groups. In order to do this, though, we had to understand a few things, such as why people with scleroderma attend or do not attend support groups, and some of the challenges that support group leaders may face. So to do this, we developed the Scleroderma Support Group Survey. This was launched in Canada and the United States just last year, and specifically adults with scleroderma were recruited through the Scleroderma Society of Canada and the Scleroderma Foundation. Patients were asked to complete an anonymous online survey that took approximately 10 to 15 minutes to complete, and separate surveys were administered to support group members, people with scleroderma who do not attend support groups, and support group leaders. So I'm here today to talk to you about the first two surveys, support group members and people with scleroderma who do not attend support groups, because this will kind of speak to the benefits and limitations of current support groups. Okay, so the member survey was completed by 171 participants. These are all people who have scleroderma and who currently attend support groups. The aim of the survey was to assess why do people join and continue to attend support groups, as well as the organizational factors that they consider important for a successful support group. So, here we have the top 5 reasons for attending support groups. So in other words, the top 5 benefits of attending. So as you can see, there's knowing that I'm not alone, learning how other group members deal with issues related to scleroderma, getting suggestions from other group members, and other practical or more practical benefits such as learning about medications used in scleroderma treatments and their potential side effects, and learning about current scleroderma research. Here we have other benefits that we kind of just picked. There were 30 that we assessed, so this is another 5. We have spending time with people who understand what it's like to live with scleroderma, learning helpful nutrition and food preparation tips for people with the disease, finding out how other patients have handled changes to their appearance. One that I hadn't thought about, but enjoying fun social activities. Some people reported going bowling with the other people in their support group, and learning how to talk to family and friends about scleroderma. So here we have the organizational factors that people said were important for a successful support group. I think these are kind of interesting if you're thinking of starting a group, then maybe keeping these in mind. Perhaps not surprisingly, the most important factor was that there's an opportunity for members to discuss their feelings and concerns. Also important was having guest speakers come discuss scleroderma-related topics. There was also the types of people who make up the group. Participants said they didn't just want it to be people with scleroderma, they wanted their loved ones to be able to attend as well. And actually, in a lot of support groups, we see that that is a possibility. Another important factor was that the group leader has received training or accreditation for their role. And finally, the location of group meetings. People wanted meetings to be held at a neutral site, such as a community center or a hospital, but not a church or private home or things like that. Okay. So on to the next survey, the Nonattender survey. 242 people completed that. And so these are people with scleroderma who say, we don't attend support groups. And the aim of this survey was to assess the factors that influence people's decision to not attend. So in other words, what might be current limitations? So first and foremost, these are the top 5 reasons for not attending support groups. And the top one was, I already have enough support from family, friends, or other people. That was followed by, I do not know of any support groups offered in my area. And there was also some practical limitations, such as the time of the meeting does not fit my schedule, or getting to and from the meetings is inconvenient, maybe due to weather, distance, or other factors. And finally, I'm uncomfortable seeing other people with scleroderma who may be worse off than me. Other reasons for not attending, again handpicked here and there, are I do not think I would learn more about scleroderma than I already know. I think support groups are too negative. Probably heard that a few times, eh? I do not know enough about what happens at a support group. I think support groups spend too much time discussing non-scleroderma related topics. And finally, I'm worried that my privacy will not be respected. So, altogether, the results of the member survey suggest that the reasons people with scleroderma attend support groups are for emotional support, practical support, so information about doctors, medications, treatments, and also for a sense of community. The Nonattender survey, on the other hand, revealed that the reasons people with scleroderma do not attend support groups are they already have enough support, availability and accessibility issues, and discomfort seeing others with scleroderma. Those were like the top three. Now this is interesting because saying that already having enough support is a limitation of current support groups, it's interesting in the sense that we learned from the member survey, hey, actually attending a support group can maybe provide you with support that your family and friends cannot. It may offer a unique type of support. Also, the availability and accessibility issues are interesting and definitely something that can be something done about, in that we need to obviously increase awareness about support groups, what it is they do, where they are, how to find one. And online support groups may be an economical and feasible option for delivering support to those with scleroderma who can't maybe access support groups because of distance, weather, the symptoms, so on and so forth. So, lastly, where are we at now? Well, I am so happy to be here for this reason in particular. We are launching the support group survey in Europe. So we had such a good turnout in Canada and the US, and we want more information. We want to hear what the experience is like for people in Europe. So we translated the survey into English, French, Dutch, German, Italian, Portuguese, and Spanish. It is up and running, ready to go. And if you're interested in participating, being part of this, sharing your experiences and your viewpoints on support groups, I encourage you to please email me. Ultimately, this will be used to help leaders feel more supported in their role, be more effective in their role, to increase the accessibility and the ultimate effectiveness of support groups. So I just want to say, lastly, thank you to everyone who's contributed to this project. It's been quite a pleasure. So thank you.
Thank you also for your interesting presentation and for the contacts. I will contact you. Okay. And now we have Dr. Jason Lee, who is a rheumatologist, works in the Ontario University in Canada. He works with Dr. Janet Pope and is having his PhD in Scleroderma. He will talk about patient symptoms that cannot be measured.
Thank you very much for having me here today to give this talk. Very excited to be here. I'd also like to thank Dr. Janet Pope for sharing her slides with me so that I could be here to share them with you. Before I begin, I also want to comment about how wonderful it is that this room is nice and warm. The scientific session auditoriums are freezing cold, and I'm happy to be here and not there. So to begin, I'll be talking to you about symptoms that may be painful to you that are not measured in the clinic. And some of you might be thinking, what does that mean, not measured? I didn't even know that symptoms were being measured other than the tests and the blood work. So we'll be going over those things. First, I'll start off by going over what your healthcare team is thinking and measuring when they're seeing you in clinic so that they can help you with your scleroderma. And then we'll go over what symptoms aren't being measured and what that means in terms of your care and how you could be in charge and in control of managing those symptoms that are not being measured by your healthcare team. And then we'll go over what could be done or some strategies to maximize or optimize your symptoms so that they're not so bothersome. So everyone here knows that scleroderma has many symptoms, and not just the ones that your healthcare team measures in clinic with pulmonary function tests, blood work, or urine tests. And the reason why scleroderma has so many symptoms is that it's a multi-system disease and it affects many different organs. Lupus is typically known as the disease with 1,000 faces, but I think that scleroderma also has a lot of variability, and I think a lot of people experience scleroderma in their own way, which is a bit different from what another person with scleroderma might be feeling. So it's important to know what your disease is and what your organ involvement is so that you could figure out what's special about your disease and what you could do for yourself. Some of the things that your doctor and your healthcare team is thinking in clinic are things that could be measured, and the reason why they're measuring it is because when they measure something, it means that they could do something about it. So things like how thick your skin is, they could treat that with medications. Your Raynaud's symptoms can be measured in terms of how frequent they are and how severe they are, and your doctor or your healthcare team is measuring that so they could alter your medications to lessen the frequency and the severity. So this list is just some of the examples of what your healthcare provider might be measuring regularly. So Raynaud's, your fingertip ulcers, pulmonary hypertension, and pulmonary fibrosis are things that you may have undergone testing, like pulmonary function tests where you have to breathe into that machine, or an ultrasound of your heart called an echocardiogram to measure the blood pressure in your lungs. Some of you may have experienced scleroderma renal crisis, and some of you may be already in the habit of measuring your blood pressures at home. Certainly your doctor and your healthcare providers are attuned to measuring your blood pressures so that they could make sure your kidneys are healthy from your scleroderma point of view. And obviously arthritis and hand function, your doctors are measuring for inflammation so that if your joints are aching from inflammation in your joints, your doctor is doing something about it with medications. But like I said, the point of measuring all of these things in clinic for your healthcare provider is that they could do something about it with medications or alternative management strategies like physiotherapy or occupational therapy, for example. So obviously this list that I talked about is not the entire extent of your symptoms. We said that scleroderma has many symptoms, and I know that you have many symptoms that don't necessarily always fit this list. So self-education is extremely important, and knowing what your symptoms represent is going to help you develop strategies so that you're not burdened by anxiety of what's happening. And even further, you could figure out what you could do about it so that it's not affecting your life on a day-to-day basis. So some of the things that you may be experiencing, but not necessarily specifically being addressed in the clinic, include these 5 symptoms. Fatigue and energy is obviously a big part of scleroderma, but it's not something that's specifically addressed all the time in clinic. We'll talk about painful hands and painful fingers, and it's not something that you can measure necessarily by doing a test, but we'll go over some of the strategies for figuring out why your fingers hurt. Itchiness, obviously, this being a skin disease, is a huge component of it, and we'll figure out, or we'll go over what could be causing your itchiness and what you could do about it. We'll talk about your arthritis and joint pains. what that could be caused by, because it's not always just inflammation that your doctor is measuring. And then we'll talk about shortness of breath, because pulmonary hypertension, pulmonary fibrosis, and just shortness of breath or breathless in general is a major contributor of quality of life. So we'll end with that. So I think it's interesting that in the last talk, one of the main reasons for having a support group is that you want to discuss your concerns with other people who have the disease. And I think part of that is you want to know if your symptoms that you're experiencing are part of the disease process, and if this is something that you should be expecting, or if this is something abnormal and this is something that you need to be worried about. One of the things that I think, one of the strategies that could be helpful in alleviating a lot of that anxiety is having an idea or a checklist of what your symptoms may be coming from or what they may be representing, so that you have an idea in your head as to what's serious and what can be dealt by yourself at home, for example. So energy issues are very common, and like it says on the slide, there's many different reasons why you could have low energy. It may be related to your scleroderma. It may be not related to your scleroderma, and you wouldn't know unless you had a process of eliminating the serious things in your head. So one of the easy things that your doctor or your healthcare team can measure in the clinic is low blood levels or low hemoglobin. Hemoglobin in your blood is responsible for carrying oxygen to your different tissues, including the brain, where you sense energy levels, for example. Two common reasons for having a low blood level or low hemoglobin is bleeding in the stomach, which scleroderma patients are prone to getting because of the acid reflux that you get in your esophagus and in your stomach. And it could also just be from chronic inflammation, because inflammation in your stomach alters the way that you absorb iron into your system. So other diseases that have inflammation chronically, like rheumatoid arthritis, for example, they have the same problem, even though it's not a stomach issue. Low hemoglobin or low blood is something that your doctor can measure in the clinic. So when you go to your doctor or your healthcare provider about energy issues, this is one of the things that you could discuss with them and say, hey, do you think my energy level could be low because of low hemoglobin or low blood? And then your doctor could check and say, oh yeah, your hemoglobin is low. And then they can treat that, and it's an easy fix. If you have pulmonary hypertension or pulmonary fibrosis from lung involvement or your heart involvement, you can have low oxygen, and if your organs are affected to the point where room air isn't enough, then your doctor can measure that and supply you with supplemental oxygen at home, and that could potentially greatly improve your shortness of breath or your energy level. Some of the things that your doctor is not being able to measure in the clinic is the degree of pain that you're experiencing, unless you're going to your healthcare provider or your healthcare team and saying, my pain is severe enough that it's consuming my day-to-day life, and I feel tired because my pain is not well controlled. In that case, even though your doctor isn't necessarily measuring for it at every clinic visit, they can address that problem. One thing for you to know in terms of pain is that there's different kinds of pain. So there's nerve pain that feels like numbness or tingling or shocks from time to time. And then there's achiness that's not necessarily from nerve damage, but from, for example, low oxygen or inflammation in your muscles and tendons. So when you go to your healthcare team and reporting pain, it's helpful for them to know what kind of pain you're experiencing as well, and that can help. Poor sleep and mental health issues such as depression, they're not always the easiest symptoms to measure, but fatigue can obviously come from not getting enough sleep. So if you have a sleep diary, or if you keep track of your sleep patterns, sometimes they can help you with sleep hygiene. And occupational therapists are specially trained to help you in that way. If you have a sleep disorder that's related to your scleroderma, you could also be referred to a sleep specialist who may be able to help with your sleep and hopefully improve your energy level and fatigue during the daytime. And then obviously, because scleroderma affects many different organs, including your skin and your joints, sometimes your movements are not what's normally mechanically easiest. So sometimes if your left hand is affected by skin tightness, your right hand is not as much, then you're using your right arm all the time, you're going to feel tired on the right side of your body because you're overcompensating. So just small things like that, if you keep track in the back of your mind, why am I being tired or why do I have such low energy today? Having a checklist like this may help at least figure out some of the symptoms and the anxiety with it. We talked about low blood or low hemoglobin. I'll just quickly touch on what your doctor could be screening for in the clinic, because it can rarely be life-threatening, but more importantly, even if it's mild bleeding in your stomach, it could go unnoticed and it could cause a lot of disability during the daytime. The testing that your doctor would do is an endoscopy or a camera in your stomach to look for ulcers or tears in your stomach. The top, So the top picture is just looking at your esophagus, the swallowing tube, and some of the tears that you can get from the stricture. If you eat a food that's too big in volume, for example, it could stretch your esophagus and cause a tear. And sometimes that could be chest pain. Sometimes you may not feel it at all. So if you're having low energy, it could be small bleeding from something like that. The bottom picture is a picture of something called a watermelon stomach. That's very characteristic of scleroderma involvement in your stomach. Basically, it's dilated blood vessels that are not normal, and those blood vessels that's become big are more sensitive to acid and small tears, and it could bleed. So if those blood vessels that are a bit bigger than usual are bleeding very slowly, you may not notice it in your stool, but you may notice it as fatigue, and your doctor can measure it. All of these in your stomach are treatable because there are antacids that could reduce the acid in your stomach, and so it's not irritating your esophagus and your stomach as much, and you're not bleeding, so you fix the low blood problem. So next we'll talk about painful fingers. Like the low energy issue, you can have painful fingers for many different reasons. The top 3 most common reasons for having pain in your hands is number 1, Raynaud's. And then if your Raynaud's are severe enough, sometimes they could lead to ulcers at the fingertips. And then obviously this disease starts with Raynaud's and tightness in your hands, so skin thickening and tightness can become severe enough that you get contractures, and that can cause pain. So everyone knows what the pictures on the right-hand side are. That's Raynaud's, where your fingertips turn color and it's very painful. The reason why that's happening is the pictures on the bottom left. On the right side is a normal blood vessel where the blood vessel pipe is nice and wide. There's lots of room for your blood cells to get through and get to tissues. But on the left lower hand side, you can see that the pipe or the blood vessel is very narrowed, and there's very little room for that blood cell to get through and carry oxygen. So this is the reason why you're experiencing Raynaud's. If you're in a cold temperature environment, your blood vessel is going to clamp down. So that's going to worsen that narrowing of the blood vessel, and that's why you're not getting blood flow to the fingertips. That's why it changes color, and that's why it's painful. So treatment of Raynaud's is largely medications, but there are lots of things that you could do without medications to try to reduce the frequency and the severity. Everyone here has been told to avoid the cold, and that's why I was so happy that this room is nice and warm. But it's not always putting on gloves that fixes the problem. If you're outside in a cold temperature and your core temperature is cold, then putting on gloves isn't going to do anything because your body is going to sense cold temperature in your core and try to clamp down on your blood vessels in your hands and feet to try to get the blood to the warm areas and warm up the core temperature. So if you're experiencing Raynaud's and you think it may be because of cold temperature in your environment, it's important to know to put on gloves, but also to be mindful of your core temperature. Make sure you wear extra layers so that the glove is more effective. Smoking cessation, so stopping smoking if you are a smoker. There's lots of benefits to stopping smoking. There aren't any trials or research data to prove this per se, but it just makes sense. If it's a blood vessel problem where your blood vessel is too narrow, smoking only makes that worse, so stopping smoking is going to help your Raynaud's and heal your ulcers. Many of you or some of you may be on medications to try to help relax those blood vessels. So when they're narrow, the best we could do is try to relax the blood vessels to make it wider so that your blood cells have more room to carry the oxygen to your tissues. So calcium channel blockers are the typical example and usually the first line therapy. If calcium channel blockers don't work, then there are other options. Now, your doctor may be prescribing your calcium channel blockers as an as-needed pill, and for many people, that's all you need. When you feel your Raynaud's, you take your quick-acting calcium channel blocker, and it often works. But sometimes your blood vessels are twitchy, and you need a baseline calcium channel blocker on board all the time. So you kind of have to play with your medications with your doctor to know which method works better, if you take it all the time to try to prevent the attacks, or if you could take it as needed and get away with it, not taking it all the time. So that's where you can personalize it a little bit to yourself. Some of the other options, if your Raynaud's and your ulcers are severe, there are creams that you could use at the base of your fingers with topical nitrates in it. Often they're helpful, but they're temporary, so you have to put them on over and over. Some of the other medications are more prone to side effects, like alpha blockers are effective at relaxing the blood vessels, but they also make you dizzy when you stand up from a chair, and it can make you prone to falls, so you have to weigh the side effects with the benefits. Treatment response, like I talked about, with Raynaud's is variable, so not everyone is going to have the same benefit from medications. But like I said, the goal is to personalize it to yourself. So if you notice that it works well, but if you take it as needed, it's not as good as if you take it every day, then you know that you have to take it every day. The goal of medication in Raynaud's phenomenon is to reduce your attacks by about 30%. That's what's known in the literature. It doesn't work all the time, but hopefully it'll be enough that it's not affecting your function. Some of the things that's been studied and we know doesn't work include these therapies. So we know that nerve cutting or sympathectomy don't work, and it used to be commonplace, but nobody does that now. If somebody recommends that to you, I would say no. Botox injections actually are controversial. Some of the data in the past have been negative, but there are more recent evidence that says maybe it can be helpful in Raynaud's. So if you get asked to do a trial, it is a gray area, and it might be interesting to know. Steroids don't work for Raynaud's phenomenon, and they have the worst side effects, such as putting you at risk for scleroderma renal crisis. So if it's strictly for Raynaud's, I would never go on steroids. Anticoagulation made sense theoretically because you thin the blood. You'd think it makes it easier for the blood cells to get through the narrow tubes, but unfortunately they don't help with Raynaud's. And the same thing for antiplatelet things like aspirin. It was the same idea, try to make your blood thinner, but it didn't help with Raynaud's, so that's the evidence for that. There are some alternative medicine or complementary things that don't involve medications. The ones that have the best evidence are laser therapy and gloves, but unfortunately, these studies are hampered by low numbers, so they're not as reliable as the medication studies that I quoted earlier. Things like acupuncture and diet with antioxidants and essential fatty acids have been studied, but again, they were negative studies, so I would say it wouldn't be my first go-to. If you've tried these things and you think it works really well for you, then I wouldn't fix what's not broken, right? So if it works for you, then that's great. But in the literature, it hasn't been proven to be very good. The reason why we dwell on Raynaud's phenomenon is that the complications are can be quite severe. So because it's a blood flow problem, if you don't get enough blood to your tissues at the fingertips, it can cause ulcers, and those ulcers, if they don't heal, can cause even bigger problems like infections and amputations. So it's easier to prevent things than to fix things. So when you have Raynaud's, it's not just Raynaud's. You have to get on top of it right away and make sure you stay on top of it. We can move on to itchiness, because this is obviously a big quality of life issue in patients with scleroderma. Again, it's a multifactorial issue, but the reason why you're feeling itchy is that your skin is inflamed, and when there's inflammation happening at the skin, you release histamines, or the allergy cells that make you itchy, so that's why you're feeling the itchiness. Like I said, the mast cells are involved in inflammation, and those cells release histamines. So one of the guidelines actually is to try antihistamines over the counter if you're finding that the itchiness is quite severe. Other things that could be causing itchiness include stretching of your skin. So just by the fact that your skin is puffy at the fingertips, the stretching of the skin can make you itchy. And sometimes it's not to do with inflammation or your skin at all. Sometimes you can have a different disease, such as liver disease associated with your scleroderma, and having a buildup of bilirubin from liver disease can cause your skin to be itchy. So if you're noticing that you're itchy in places where you don't have skin involvement from your scleroderma, then check the color of your skin, because maybe it's your liver that's causing your itchiness. Some of the things that you could do about the itch besides over-the-counter antihistamines include things like moisturizers, less washing with soaps and detergent, making your skin dry can be helpful. So if you could make a habit of soaking your hands in warm water, that often helps. In very rare instances, if your itchiness is severe and it's because of that inflammation I was talking to you about, low-dose steroids for a very short time can help, but I would be careful about that because of the side effects of steroids. And then finally, arthritis. Arthritis can be a huge component of scleroderma, and it could be a big component of why your hands hurt. So we'll go over some of the checklist things in arthritis. Arthritis treatment in scleroderma is very similar to treatment of other inflammation arthritis, like rheumatoid. So the medications that we use for scleroderma arthritis are almost the exact same as we would use for rheumatoid arthritis. So the very first thing that you would be given for arthritis and scleroderma is methotrexate, and you can take that either by mouth or by injections. They're both equally efficacious, so you decide what works better for you. Some people think that when you take it by injection, it gives you less nausea. Some people don't find that, so you kind of have to play with it with your doctor to see which one works better for you. Besides methotrexate, the first things that you could be put on is Plaquenil or hydroxychloroquine and low-dose steroids. But steroids for arthritis, again, and scleroderma especially, is a temporary solution to get your disease under control. And then you get other medications like methotrexate to keep it under control. If methotrexate isn't enough for you to keep it under control over the long term, then your doctor may consider other medications like biologics. I would say the functional issues that you get or the disability you experience from your arthritis and scleroderma is just as severe as someone with rheumatoid arthritis, if not worse, because it's not just the arthritis you're dealing with, it's also the skin thickness and the contractures. So if you have functional issues over time, it's something to be mindful of and let your doctor know about and not be intimidated or shy about expressing that concern. Other things you could do in terms of arthritis besides medications include occupational therapy. So hand stretching to prevent the thickening from contracting is hugely helpful, and even small improvements in the flexibility in your fingers go a long way towards keeping the functionality in your hand. So I would encourage you to work that into your daily routine. And then I know I'm going a little bit over my time, but I'll try to be quick with the breathlessness. Simply put, there's not a lot of reasons why you could be breathless. So the checklist is a little bit shorter, but the things that can make you breathless are serious, so something to keep always in the back of your mind. Obviously, you can be breathless from disease affecting your lungs and in your heart, but also it could be because the thickness in your chest is preventing you from expanding your chest and in your lungs. So it could be from the skin disease and not necessarily organ involvement. So when you feel breathless, obviously be worried about organ involvement, but it could be other things, so I wouldn't automatically jump to the worst case scenario. If you're deconditioned from reduced activity from your arthritis, for example, and you can't go for walks or exercises, you can get breathless just because you're deconditioned. One thing that I'll mention quickly here is that as part of your routine healthcare, you should always remind your doctor, if they're not doing it, to screen you for lung and heart diseases. Because it is the number one cause of death in patients with scleroderma. So pulmonary function tests and heart echocardiograms are extremely important, and that should be done as a routine in your care. And then the last couple slides I have here for you is what you can do at home for your breathlessness. And besides the care that your family or your healthcare team provides for you, I would say one of the best things that you could do is exercise. So for other lung diseases like COPD or congestive heart failure, which are similar to the lung and heart problems in scleroderma, one of the best things that a patient could do to help their breathlessness is exercise. So it helps with fatigue, it helps with the emotional stress, it helps with the breathlessness, so you feel less short of breath, and it improves your quality of life, and it reduces hospital admissions. And these studies weren't people running on a treadmill for an hour 7 days a week. These studies were done with people walking for 15 to 30 minutes a day, 2 to 3 times a week. So if you could work that into your routine, then obviously over the long run, it can make a huge difference in your quality of life.
Dr. Lee, sorry, we have to finish.
Yeah, no problem. The scleroderma renal crisis is not as big a problem now as it used to be, but just that you should keep in the back of your mind about your blood pressure. So if you have a blood pressure machine at home, keep a habit of checking it, and that's about it. I think the main thing that I've talked about here today is having a strategy for how to understand your symptoms so that you could figure out for yourself what you need to go to your doctor about so that they can measure and fix it, and what you could deal with at home, because it's not necessarily something you can measure, but obviously it's impacting your life. Thank you.
So these sections are now open for questions. over here.
Mira, yo quería preguntar sobre lo que ha dicho de la inyección de botox para el síndrome de Raynaud.
¿Eh?
Sí. ¿Dónde se tiene que ir?
Dr. Lee. The question is about the botox injection for Raynaud syndrome. Okay?
Okay, so in terms of Botox injections, the evidence right now, like I said, is controversial. The best evidence for it is for Raynaud's phenomenon. So if you're having severe Raynaud's, your family doctor, your rheumatologist, your dermatologist, anyone who's trained in using Botox can put the Botox injections at the base of your fingers. So sometimes that relaxes the blood vessels and helps long-term, sometimes several weeks. Yeah, so it's not at the fingertips, it's at the base of your finger. Usually not at the wrist, but at the base of the finger where you're having the worst Raynaud symptoms. Yeah, sometimes in between the fingers, sometimes on the outside of the finger. So wherever there's a blood vessel going from the back of your hand or the palm of your hand into your fingers, you want to relax it at the base so that it'll open up the blood vessel and let... Exactly, yeah.
Any other questions? Another one here, please.
Yo no sé inglés. Is possible have Raynaud in the stomach, intestino,
Que haja Raynaud nos
en
órgãos?
órganos internos?
It's possible to have Raynaud phenomenon in internal organs, not only in the fingers.
Possible to have which phenomenon?
Uh,
Raynaud's phenomenon.
Raynaud phenomenon.
Oh.
Sorry.
It's a good question. So I would say Raynaud's phenomenon is a blood vessel problem where your blood vessel is narrowed. So you can have that narrowed blood vessel problem anywhere in your organs. People think that Scleroderma renal crisis is a blood vessel problem where the blood vessel to your kidneys are too narrow, and that's what causes the high blood pressure. And that's why a blood pressure medication called ACE inhibitors are the treatment for renal crisis. The narrowed blood vessel problem can affect other organs. We don't know if it's the direct cause for lung issues, but lung pulmonary hypertension is a blood vessel problem. So that's why pulmonary hypertension medications are blood vessel medications that relax blood vessels. There is some evidence. Dr. Dinesh Khanna in Michigan in the U.S. have published about heart disease in Scleroderma, so you're at higher risk of heart attacks in patients with Scleroderma. So again, another blood vessel problem. The important thing to know about organ involvement is that these things are testable. These things are things that your doctors can measure in the clinic. So if you're worried about your organs, or if you think that blood vessels in your hands may be affecting your organs, one, you should have symptoms. And if you feel like you have symptoms, then ask your doctor, because these are things that can be measured and treated.
Thank you. Another question over there?
Thank you. Excuse me. Is the very question. Mi English is very bad. ¿Es la misma? ¿Hay alguna forma demostrable que pueda ser Raynaud también dentro de otros órganos?
Si es demostrable, que se puede demostrarlo.
Pero con alguna prueba, si se puede demostrar.
Is possible to show the Raynaud phenomenon in the organs? Can we measure? Can we see the
Can we measure which?
Raynaud phenomenon in the organs? This change in the.
I would say Raynaud's is a name that's specific to your fingers, basically. The spasms that you get with Raynaud's phenomenon can happen in any blood vessel, but Raynaud's phenomenon is a specific term for what happens in your fingers and toes. Like I said, blood vessel problem is everywhere in scleroderma. It doesn't necessarily affect all of your blood vessels, but it is the basis for a lot of the organ problems. So if you feel like some of your symptoms could be from low blood or low blood flow, then these are things that your doctor can measure. So they could test your heart, they can test the pressure in your lungs, they could test your blood pressure, they could test your kidneys. So if you're concerned about these things, your doctor can measure them, and these are treatable. So if you feel like your symptoms are related to blood flow or blood levels, then talk about it with your healthcare team.
So we are finished. Thank you for the speakers. Thank you for being here. And thank you, Fresca, for the invitation to be here. And congratulations for the excellent work. I give words. Don't leave the room. I give word to Anne Kennedy, president from Fresca, who is going to show something.
The last item that you have on your programs is a session with Dr. Leslie Ann Saskatoon. Now, she couldn't come. She's in America, and because of illness in her family, she couldn't come. But she sent a presentation video with a voiceover, and it's specifically for you to relax at the end of the day. So we can release our speakers, and any of you who want to leave, please feel free to leave. But I'm going to play that now, if I can find it. Maybe I need some help here. Yeah, if you can find the next one. And it's called Mind and Body Strength, and it's a meditation and some exercises, and it's specially designed so that you can leave in a calm frame of mind, because some of the things you've learned today may be upsetting. So you can stay for as long as you want. It's 10 minutes.
All of what I'm going to talk about today is focused on Good afternoon. Good afternoon. It's a pleasure to be able to participate. So, mind-body strength is wholly reliant on our ability to focus upon ourselves and to find the value and the power in focusing on ourselves, because when we do such a thing, then we are able to really optimize our well-being and therefore be more available to others. And I think that's probably everyone in this room's greatest concern, being available for others. So, all of what I'm going to talk about today is focused on allowing your attention to fall upon yourself and assess your needs. And this requires a component of mindfulness and listening to oneself. And through this mindfulness, we develop a stronger and deeper acquaintanceship with our ability to focus and our ability to be in touch and be our best selves, and that includes making good decisions. So I'd just like everyone to take a quick moment just to feel this for a few seconds and allow your body to relax. Uncross your legs, uncross your arms, and allow your eyes to soften and allow your hands just to rest gently on your belly. and allow yourself to notice the changing sensations in your body that comes with the inflowing breath and the changes with the outflowing breath. These changes can be like a little bit of pressure in your belly, or an expansion in the back, or a little bit of pressure on your bottom as you breathe in and less so when you breathe out, or like a massage, or even the sensation of the breath tickling the tip of the nose. But whatever this is, it allows us to relax our focus onto ourself and come back into our body. And this is a technique in itself, but this technique is what's going to allow us to make good choices for ourselves and remain both physically and mentally in a place where we handle stress much better and we maintain a life balance and therefore can handle our symptoms better physically as well as mentally. The three components of choices that we have in the day in regard to directly to our health are the choices and the organization we apply to eating, to sleeping, and to moving. And these are interconnected with each other. And interestingly, each of these important elements, sleep, nutrition, and exercise, are related to inflammation. We know inflammation, for example, is increased when we have poor sleep. And the hormonal effects of inflammation on the brain and body cause fatigue. And we can reduce inflammation with healthy types of movement and exercise and perhaps even food choices. And we know that inflammation has a direct effect on our muscles and bones. Sleep in scleroderma, we know, is very important. There are a few but powerful studies, but all are demonstrating that there is poor sleep quality in people living with scleroderma, and this may be in relationship to breathing or GI symptoms or the anxiety about living with the uncertainty of a chronic illness, perhaps influenced by depression, pain that's experienced. And oftentimes in scleroderma, patients have itching, which may be exacerbated at night. And also restless leg syndrome is recognized in systemic sclerosis. So improving the quality of our sleep brings with it tremendous benefits. It improves globally our quality of life, allows us to think and make good decisions during the day, and helps us to feel good inside of ourselves, decreases pain. And many don't realize, but having good sleep actually improves the pain threshold and decreases inflammation, as well as helps us stave off depression and anxiety and help cope with it much better, and generally increases happiness. The Epworth Sleepiness Scale is a way of assessing how well or not we might be sleeping. You can find the link for this on the handout, and if you find that you are having difficulties with sleep based on this, it's a wise idea to discuss this with your physician. In addition to finding strategies to manage the symptoms of systemic sclerosis that might be interfering with sleep, such as GI symptoms, depression, pain, anxiety, and itching and restless leg syndrome that we talked about, I'd like to highlight a very important area of investigation if somebody does have poor sleep quality, and that is the potential presence of a sleep disorder, namely obstructive sleep apnea. I request that all my patients fill out this questionnaire called the Stop Bang Questionnaire. The link is available on the handout, and this is available in several languages. This questionnaire assesses one's risk for sleep disorders such as obstructive sleep apnea, which, if recognized, can be treated and have a direct effect on someone's health. an important component of how well we sleep is how we're managing and organizing our sleep, and this is known as sleep hygiene. And according to the American Academy of Sleep, it's one of the single most important things that you can be doing, and that's paying attention to yourself. And when you do that before you go to sleep, you increase your melatonin, which is important to sleep. This is that special unwind time, the routine that lasts about half an hour before you go to sleep, that your brain recognizes when you're going through these motions and starts to prepare you to open yourself up to allow a deep restorative sleep. Other aspects of sleep hygiene includes having a healthy movement regimen, as we'll talk about shortly. There are medications that can make sleep better and make sleep worse. Look at the handout and go through some of your medications with your doctor. Caffeine, learn to recognize it because it can creep up on you, and try not to have it if you're having sleep problems after noon. And very importantly, we try to get folks to recognize that technology, especially 60 minutes before bed, can really interfere with one's sleep. The blue light from the electronics actually causes a decrease in the hormone melatonin, which is necessary for sleep. And we try to get folks to avoid video gaming, texting, and blogging, and to get folks to turn their phones off before they go to sleep. Nutrition is another essential element that is necessary for mind-body strength, and referenced in the handout that you will receive. The last important topic that I would like to talk about, which is essential to one's health and mind-body strength, is moving, and to remember that every little bit that you do is beautiful and is healthful, even standing up, even walking over to the water fountain at work, for example. Trying to find any reason to move. Any movement that we do for ourselves is healthful, but a regimen, like medicine, a regimen of movement introduced into your daily routine of 15, 20 minutes, maybe building up to half an hour, 5 days a week, is best. And we know this has a great impact on our brain's ability to function, our ability to work, our perception of pain, improving our sleep, and the reduction of fatigue. And we can say unequivocally that movement is medicine. Movement is medicine. When we move, our body produces chemicals and molecules that are similar to those in medicines that we take to lower blood sugar, cholesterol, blood pressure, inflammation, to reduce pain, to reduce anxiety and depression. One of the most essential things about moving for health is that movement should be pleasurable. Movement should feel good in the muscles. It should feel good in the skin. It should feel like maybe a massage, a gentle massage, or just something lovely. And these are sensations that you can focus on and connect with even when you're walking to your car, for example, or when you happen to be doing the dishes or vacuuming. But connecting with the pleasure of a movement and allowing movement to have pleasure also protects against injury and pain. The last slide I'd like to leave you with is the remembrance that every little bit you do in movement is beautiful and is healthful.